Thank you for joining. I would like to introduce Leader of the Ontario Greens, Mike Schreiner.
Bonjour tout le monde. Good morning, everyone, and thank you for joining us. I'm speaking from my home in Guelph on the Treaty 3 lands of the Mississaugas of the Credit First Nation, and would just like to express my gratitude for what I've learned from Indigenous peoples about how to be a good steward of the place I call home, and also to reaffirm the Green Party's commitment to the truth and reconciliation process. I'm joined here today by Laura Campbell, who is our candidate in Dufferin-Caledon and a small business restaurant owner, a very popular restaurant in downtown Orangeville. I'm just honored to have her with us today. And while I know the focus of my conversation today is going to be on the supports that small businesses need, I just really want to take a moment to just say how sad and disgusted I was by some of the events that took place over the weekend in Ottawa. While I believe deeply in the right of people to protest, desecrating the War Memorial, National War Memorial, the Tomb of the Unknown Soldier, Terry Fox statue, stealing food and intimidating staff at a homeless shelter, and other events such as flying Confederate and Nazi flags just have no place in Canada. And I am eager to work across all party lines and all jurisdictional lines to combat hate and systemic racism and white supremacy in our country. Small businesses in Ontario are struggling. Only 28% of Ontario's small businesses are operating at normal revenues. The average COVID-19 debt for small businesses in Ontario is $190,000. And 19% of small businesses who haven't already gone out of business are considering bankruptcies. Today is the first step of reopening. And while it's going to be welcome news for many small businesses, the reality is that many are still struggling, and many will be operating at 50% capacity, which means they will still, in many cases, be operating at a loss. When Premier Ford announced the most recent round of public health measures on January 3rd, I called for immediate support to help small businesses that would be required to close their doors in the name of public health and safety, which most small business owners I support, or I've spoken to support. So the bottom line is small businesses shouldn't be penalized for doing the right thing. But all the Premier offered was empty platitudes and a little bit of support that might be delivered a month later. I can tell you as a longtime small business owner that cash flow is critical to being able to pay bills and to be able to maintain staying open. Doug Ford continues to delay and be dollars short in delivering the support that small businesses need. And that's why the Ontario Greens are calling on the government to immediately expand eligibility for the new Ontario COVID-19 Small Business Relief Grant to all impacted businesses, even if they are not fully closed. To add another round of funding for February, given that many sectors will still be operating at below 100% capacity. Increasing the amount of available funds and expanding the staycation tax credit to include indoor dining at restaurants. And adding additional sector-specific support for businesses that have been hardest hit, such as gyms and restaurants, which have been closed for over 400 days, particularly in places like Toronto. The bottom line is there will not be an economic recovery without small businesses. And the Premier has left many small businesses out to dry throughout the pandemic. And that's why the Ontario Greens will continue to fight for supports for small businesses, which provide the vibrancy in our downtowns and main streets across the province. We need to ensure that small businesses can survive so our communities can thrive. Now I'd like to pass things over to Laura Campbell to not only talk about what it's like to be a candidate in Dufferin-Caledon, but what it's like to be a restaurant owner in downtown Orangeville.
Hi, Mike. Thank you so much for your remarks. I'd also like to acknowledge that I'm on the traditional territory of the Anishinaabe, including the Ojibwe, the Potawatomi, and the Odawa of the Three Fires Confederacy here in Dufferin, in Orangeville specifically. And that's where my small business is, and my community and comrades in the small business sector as well. I've been in business here since 2009, and so we are very well established here in the community, and our community has supported us so much. While we've been at takeout only for a long time, with a brief window of being open through the fall, which was really great. And it's exactly like you said, we fully acknowledge that we had to close our dining room as Omicron raged through our neighborhood as much as across the province. So we acknowledge that that was something that had to happen. I guess the issue really is that the support that Doug Ford has announced is almost too little too late. So many businesses are already so behind, and they really needed the holiday period, including into early January, to sort of make up the losses that they've experienced throughout the pandemic. And it really did feel like things were sort of going back to normal. And so there was a small catch-up period, but then that was quickly sort of snuffed out. And so as the cost of goods that we're purchasing to run restaurants in particular go up and up and up, the impact of the small business support grant that is coming sometime soon is going to be much less. This includes the fact that a lot of business owners here locally have long-standing, almost familial relationships with their staff. As you know, small businesses are not large corporations, and layoffs are almost impossible. They're like your staff is family. So it makes it really difficult to adjust, because everyone, all the small business friends that I have, want to keep folks on payroll. So it contributes to the overall debt that so many of these businesses are carrying, because they are actually keeping folks on payroll when, in a prudent business environment, you should probably tell them to go on EI. So there's a lot of challenges, in particular in restaurants and in gyms. And there's been so many financial outlays as well in terms of pivoting. So I know the yoga studio a few doors down the road has had to pivot multiple times to different streaming platforms. And when it comes down to it, a lot of people are not really so keen on doing Zoom workouts anymore. So even their sort of folks enrolling in the classes has declined dramatically from, let's say, like March 2020. And they still have to pay their rent. They still have to, their yoga instructors still need to make money. So it's been incredibly challenging across those hard hit sectors for sure. And that's what I'm hearing from my community. And our local board of trade is organizing a group to try and think about more creative ways that our municipalities could help us. But really the onus should be on the provincial government. So, you do see the community support, you do see the rallying happening, but the Ford government needs to acknowledge that the support that's coming is not going to be enough for very many businesses. So.
Thank you, Laura, for joining us today, and thank you for sharing your experience as a restaurant owner. And we're now available to answer any questions.
Thank you. For the Q&A portion, we'll ask that you use the raise hand function if you have a question or message in the chat. We'll start with one question, one follow-up. First up, we have Richard Southern from City News. Richard, please unmute yourself and go ahead.
Hi, Mike. Hi, Laura. Good morning, guys. How are you?
Good morning. Thanks, Richard.
Mike, it seems like we had a sudden pivot from the premier on Friday evening when he told a local Ontario radio station, quote, "We've got to learn to live with this and get things back to normal." I'm wondering if why you think that sudden pivot happened and if you agree with the premier on that, Mike.
Well, the bottom line is protecting the public health and safety needs to be our number one priority. And I look at, while the numbers appear to be starting to head in the right direction, I look at the tremendous strain that our healthcare system is under. And I've met with so many nurses who are burned out, feeling overworked, underappreciated, underpaid, and, ensuring that we continue to do the things we need to do to not overwhelm the healthcare system is just vitally important. And so that is exactly why the Ontario Greens are calling for more financial support to help small businesses who have complied with public health restrictions and want to continue to keep their community safe. And in addition to that, there are a number of things the Premier could be doing to help us manage our economy and our healthcare system and mitigate the spread of COVID-19, such as permanent 10-page sick days, recognizing that COVID is airborne and implementing airborne measures such as mandatory N95 mask in vulnerable workplaces, proper ventilation in vulnerable workplaces, repealing Bill 124 so we can show our healthcare system, our healthcare workers, the respect they deserve and better retain them. So if the Premier, quote, wants to live with the virus, then the Premier needs to take the steps necessary to mitigate the spread of the virus.
All right, Mike, on another matter, I mean, you mentioned off the top the situation in Ottawa. We haven't heard from the Premier on that. We've requested a statement from his office, but haven't heard back. What do you make about the Premier's, silence on this issue?
Yeah, I'm just shocked and disappointed that the Premier wouldn't speak out about protests that are happening in the province of Ontario, in Ottawa, which the last time I heard, Ottawa was a major city in the province of Ontario. And, I just want to reiterate that I understand there's a lot of people, out there who are frustrated and tired. And I absolutely support the right to people to protest and to be heard. But, desecrating the National War Memorial, the Tomb of the Unknown Soldier, stealing food from homeless shelters, flying Nazi Confederate flags, desecrating Terry Fox statue, those are steps that go too far. And I think the Premier and I am willing to work across, as I said, party lines, working with, Liberals, NDP, Conservative members of the legislature to denounce those types of activities and to commit to legislative action to combat the rising levels of hate that we're seeing in our province and across the country.
Thank you. Next up, we have Natasha McDonald-Dupuis from Radio Canada. Natasha, please unmute yourself and go ahead.
Good morning, Mike.
Good morning.
We just would like to get a reaction to a story we published this morning. In short, we obtained a copy of all the hospital CEOs' responses to the Premier's October letter, in which he requested input on a provincial vaccination mandate in hospitals. And you'll recall that in November, when the province announced they weren't imposing it, Minister Elliott said some hospitals had written to say they were against the policy, but we found only one hospital out of a dozens actually wrote to oppose it. What do you make of that?
Yeah, once again, and this has happened throughout the pandemic, really since the summer of 2020, Premier Ford has failed to follow the science, follow the data, and listen to the advice of the Science Advisory Table, as well as public health officials in the government's response to the pandemic. And it's once again an indication that one of the reasons Ontario has been one of the most locked down provinces or jurisdictions in North America is that the premier's failed to make the decisions necessary to mitigate the spread of the virus, because he hasn't followed the advice of scientists and health officials. And the vaccine mandate for healthcare workers is a clear example of that. And the bottom line is I can't tell you how many people in the hospital system, whether it's frontline workers, doctors, nurses, administrators, have all said that one of the key elements of retaining nurses is to repeal Bill 124 so that nurses are respected and are paid what they're deserved. And I've had numerous nurses and hospital officials tell me that the failure to mandate vaccines actually poses a bigger risk to health human resource capacity, because there are a number of nurses who do not want to work alongside unvaccinated healthcare professionals because their priority is keeping their patients safe. And people who work with the most vulnerable in our society should be vaccinated.
Natasha, do you have a follow-up?
Yeah. Do you feel like the government misled the public? I mean, Mr. Elliott and other officials kind of made it seem like there wasn't a consensus in the hospitals in Ontario on this policy, but it turns out that only one hospital opposed it. So it seems like it's a mixed message here.
Yeah, it's absolutely a mixed message to suggest to the public that, there wasn't a consensus when only one hospital said no to vaccine mandates. And the bottom line is the best way to have public trust and compliance with public health measures is to be honest and transparent with people. And whenever the government falls short on that, it undermines public confidence and it undermines our ability to combat the pandemic as together. And so undermining of that public trust undermines our ability to fight the virus.
Thank you. Next up, we have Colin DeMello from CTV. Colin, please unmute yourself and go ahead.
Hey, good morning, Mike. I just wanted to ask what you would do if you were in the premier's shoes, right? I mean, at this point, you always say that, you would listen to the advice coming from the scientific doctors, but the chief medical officer of health is the one who's saying we need to learn to live with the virus. At the same time, we're seeing, polls starting to indicate that people are growing, really tired of COVID-19 restrictions and measures. So how would you find that balance between wanting to protect the public and listening to what the chief medical officer of health says, which is we need to learn to live with a virus? What would you strip back and what would you keep in place going forward?
Yeah, I think the most important measures we can be taking right now is actually utilize all the tools we need and that are in our toolbox to manage and mitigate the spread of the virus as we reopen our economy. And I think one of the most important ones that the premier has really failed to make clear is that COVID is an airborne virus, and we have to be taking mitigation measures to address an airborne virus. And in particular, making sure we have N95 proper PPE available, especially in vulnerable workplaces, mandating proper ventilation, not only in our schools, but in vulnerable workplaces, taking the steps that we need to take to shore up our healthcare system, which quite frankly was under stress prior to the pandemic, by having a strategy that the Ontario Greens called for like months and months ago to retain and recruit new nurses, which would include repealing Bill 124 so nurses can get paid properly, but also fast tracking accreditation of internationally trained nurses. So I think there are steps that can be taken that can allow us to open up our economy to make sure we can keep schools open and mitigate the spread of the virus at the same time, if the government is willing to take those steps.
Okay, thank you. And just on that, would you like to see a firm sunset date for when, at least the proof of vaccination requirements would be listed? In addition to contact tracing, proof of vaccination obviously presents an additional burden for a lot of businesses. They either had to get the technology in place or, they have to dedicate staff members to ensure that that proof of vaccination is being checked. Would you like to see the government provide some kind of a sunset date? Because everyone has said that this isn't going to be a permanent part of the measures going forward, right?
Yeah, I would like the government to establish a goal that we need to reach based on the science when that date to end vaccine mandates would happen, rather than establishing an arbitrary date. One of the things that a Canada research chair and said to me early in the pandemic, that one of the best ways to collectively as a society address a public health emergency is to have clear goals that we're all working towards. And that is something that has been, almost non-existent since the early days of the pandemic, when it was, flatten the curve. And so I think the premier needs to come out with, here is what public health experts are saying is, the quote goal we need to be at when we can lift vaccine mandates. And I think it should be based on achieving that goal rather than an arbitrary date.
Thank you. Next up, we have Adam Donaldson. Adam, please unmute yourself and go ahead.
Thank you. Good morning. And I apologize because I was a bit tardy. I had another meeting before this. So if I walk over ground previously covered, I apologize in advance. But I'm going to address my first question to Laura. There's been a lot of sort of discussion about, we just need to get the restrictions off and declare the pandemic over and businesses will bounce back. Is that a correct assumption from your point of view as a small business owner and your fellow small business owners in your community? Is a bounce back coming?
No, I don't think so. In particular, because amongst the public, there are a lot of folks who are very much recognizing that the virus is airborne, that the risk is still there, and that, regardless of their vaccination status, that because of the way in which our healthcare system is so burdened right now, that if we have another wave, it could impact all kinds of people, in particular, vulnerable folks who have medical conditions that could put them at real risk if they contract the virus, or if, for instance, they have another surgery that they need that they can't get because our ICUs are full with folks who have COVID. So, this is our experience. The last time we reopened our dining room, we didn't see people rushing back. So a lot of businesses are still having to really get creative in how they're paying their bills, how they're making ends meet. And the other part of that is too, because we are now living through the economic consequences of the last 2 years. So whether it's inflation or, low consumer confidence, because they're not sure, perhaps there's going to be another variant, perhaps there's going to be another wave. Interest rates are apparently going to be going up, though we have to wait and see when that first rate hike is coming. People are indebted because they've been laid off. And so it's unsure, whether or not this bounce back is going to be the answer, because across the province, our citizens have very different conceptions of, personal safety and whether or not they can actually afford to go on living life as they did before the pandemic began. So this is why Ontario Greens continue to call for other income supplements and supports so that people can, continue living life in a way that they can pay their bills and make ends meet. So certainly there's a lot of questions that still remain unanswered. And I just want to echo what Mike's been saying and what my friends in the nursing and healthcare profession have been saying, is that the way that we get out of this is to ensure that our hospitals and our healthcare system can bear the brunt of potentially another wave or another variant, and just to get out of the Omicron variant, because it's not fair to any of us that we just keep pretending like, well, once we're done this wave, we'll be okay because it'll be over, but it's very unpredictable. So I think the unpredictability element is still out there.
So building on that, Mike, unpredictability has sort of been an unspoken side effect of the pandemic, and building on what Colin was asking about how we're seeing a pivot, not just from political leaders, but from public health officials, Dr. Moore, Dr. Mercer here in Guelph, COVID is something we have to live with. So I guess in terms of like building the province back up, are we not kind of getting it backwards, I guess, is the question. And in terms of like what should be the direction to not just ensure that we can continue a COVID recovery, but build sort of, I hate to use the phrase because it's been so poisoned, but the new normal, but I think that's what we're talking about here. So how do we address that need to create a new normal?
Yeah, I think one thing we have to really recognize is that living with COVID for some people can be code for let's just like forget that COVID ever existed and not have any public health measures in place. And I don't think that's what public health officials are saying when they're saying living with COVID, which is why I want to really emphasize that, yes, we want our schools to be open to in-class learning. Yes, we want our economy to be open and not have lockdowns again. Yes, we want to make sure we do that in a way that doesn't overwhelm our healthcare system, which is why we can utilize other mitigation measures, such as, proper masking, proper ventilation, shoring up our healthcare resources. Those are the kinds of steps we can take so that we can manage life with a virus. Especially until it becomes endemic. And I would just say on Laura's point, I think she made a really good point about public confidence. One of the reasons the Ontario Greens have been calling for an increase in the amount of money available through the staycation tax credit and expanding it to include indoor dining in restaurants was precisely as a recommendation who came from a board member of Restaurants Canada, saying, if the government could do a little something to indicate to the public to restore confidence in going back to restaurants, this would be a way to do it and to provide a little incentive to help, support us, because for many restaurants, even with reopening, they're not going to go back to the same revenue levels they had pre-pandemic, at least initially. And so we have to work together with our community and with small businesses to restore public confidence.
Thank you. A reminder, if anyone else has any questions, please use the raise hand function or page me in the chat. Looks like that's all the questions we have for now. With that, pass it quickly back to you, Mike.
Thanks everyone for joining us today. And I just want to say to the broader public that anything you can do to support the small businesses who have been supporting our community and are just so vital to the vibrancy of our downtowns and our main streets, I encourage you to do so. And the Ontario Greens will continue to push for the supports that small businesses need in order to survive this pandemic and thrive as we emerge from the pandemic. Thank you all for joining us today. Merci, au revoir.